Hello, and welcome to the 2021 virtual St. John's University CareerCon. My name is Toni Arcamone, and I am from Staten Island University Hospital. I actually manage the volunteer department. Today, we're excited to bring you an opportunity to learn about the various healthcare careers. We're going to be talking to some really important people within healthcare who are going to share their knowledge and their requirements for their specific education. I'd like to introduce you to James.
Tony, thank you for having me. I'm very excited to be here. My name is James Cardello. I am the Vice President of Clinical Services from JAG1 Physical Therapy. I am a practicing physical therapist specializing in orthopedic care.
Thank you, James. We'd also like you to meet Lisa.
Good morning. My name is Lisa Hochstein. I am an associate professor teaching clinical laboratory sciences at St. John's University's College of Pharmacy and Health Science. And I'm excited to be back here at a CareerCon that I attended a number of years ago.
Thank you both for joining us today. We're going to dive a little deeper into each one of your career choices, what brought you to where you are today, and what educational requirements we can tell the students to expect. So, James, let's start with you. Would you mind telling us why you chose to go into the physical therapy arena?
Absolutely, Tony. So, as a competitive athlete growing up, playing basketball, soccer, and tennis, um, I suffered ankle injuries at a young age and required orthopedic care and physical therapy. And experiencing physical therapy firsthand as a patient, it was really how I first started, learning about physical therapy. And I saw and I realized firsthand how beneficial it is in regards to returning back to sports, returning back to life activities.
Excellent. Thank you so much for sharing. James, can you tell us a little bit about the education or the certification that's required in your line of work?
Yes. So as a physical therapist, there's two ways to become a board certified physical therapist. One is out of high school. If you know that you want to be a physical therapist, you can apply to college specifically for PT, and it's a 6-year doctorate degree. Another way is to go to college, specialize in sciences, get all your prerequisites done, get your undergraduate degree, your 4-year college degree, and then apply to PT school. And then it's a 3-year program. So those are the two pathways. It's either a 6-year program or a 7-year program, depending on how you do it. And it's an entry level doctorate program.
Excellent. Thank you so much. Can you share with us a little bit of your biggest challenges or successes?
Um, Successes, I would say I'm a practicing physical therapist for 18 years. I started my career with one-on-one physical therapy. A couple of years ago, we merged with another company called JAG Physical Therapy. So now we are JAG1 Physical Therapy. So I've been with the same company through my 18 years. And, it's a very team-oriented approach, JAG1 Physical Therapy. And I would say that the success of the company over these last 18 years from one location to now 84 locations within the tri-state area, we're able to have a positive impact on many, many communities. The more locations we have, the more communities we can positively impact and help people get back to the life they love, get back to sports. So I would say generally that would be the success within my career of being part of a great company.
Excellent. Would you tell us a little bit about how things changed for your specific career during 2020, during the COVID pandemic? And where do you see the changes going in the next couple of years?
Well, yes, 2020 was a crazy year. So as a physical therapist, what do? We rehabilitate patients with bone, tendon, ligament injuries. Both patients who have had surgery and patients who did not have to have surgery. Our treatments consist of exercises, stretching exercises, strengthening exercises, also manual therapy, massage, soft tissue, loosening up the muscles. So now with the pandemic, we had to pivot and go virtual, okay? And we had to figure out a way to do teletherapy, where patients were not coming into the office, and we had to continue their care and help them virtually and talk them through the exercises, and address it that way. So that was definitely a big challenge, in regards to 2020. Um, I would say another challenge, generally speaking, regardless of of the pandemic, would be we are physical therapists to help people. We are healthcare providers. We are there to get patients better. And little by little, every year, insurance companies are tightening things up, and limiting our ability to treat patients and really see them through their whole episode of care. For example, if a patient had an ACL reconstruction surgery, it really takes a year for them to fully recover. Most of the time, we are not seeing them through that whole year because of insurance limitations. So that's another challenge as well.
Thank you so much, James. If a young adult was to ask you for some direction leading into the physical therapy or rehab medicine careers, what would you say some of their best resources are?
Perfect. So I would say my advice to any student, high school student, college student that's trying to figure out their career and they're interested potentially in physical therapy. I think the best first step would be to find a local physical therapy company, local physical therapy office, and be proactive in regards to reaching out for volunteer opportunities. You can come in, you can volunteer, and essentially observe the physical therapist, go through their day, and really truly see how impactful they are, in regards to their patients, and really see if that's something that they want to do. So I think the best way would be to volunteer, observe, see what it's all about, and then take it from there.
Excellent. Thank you so much, James. And yes, I do agree with you that volunteering kind of gives you an inside look into a career before stepping into that world. And it's actually a great way for young adults to figure out if this is the career choice. Lisa, hi, how are you?
Good.
Great. Thank you so much for being here today. Let's ask you some of the same questions. Why did you choose to be a professor within the pharmacy division, I believe you said? Give us a little bit of insight into your history.
Well, if somebody would have told me I would end up at St. John's University being a professor, I would have told them they were crazy. I started my career in clinical laboratory science as a practitioner. I worked in a laboratory in a hospital as a supervisor of one laboratory within the large lab. I was the microbiology supervisor. I enjoyed teaching. I taught students who came to our hospital for training. Um, I then began teaching as an adjunct in different colleges in the area, and then had the opportunity to come to St. John's full time as a professor. I got into clinical laboratory science kind of by accident almost. I knew I wanted to do something in healthcare, but I also knew that I didn't want to necessarily touch the patient. I thought that coming in contact with people who were sick or injured, it might be upsetting and maybe something I didn't want to do. So I actually thought healthcare was, out for me. But then I found clinical laboratory science. People who work in a laboratory, they perform all of the tests that the doctors order on their patients to make their diagnoses. And so in the background, you are helping the patient. You're giving the doctor the information he needs to help people.
Excellent. Thank you so much, Lisa. Would you share with us a little bit of your education or the certifications that might have been required to whether work in a lab or to be at the college?
Okay, with clinical laboratory science, there are basically two levels of clinical practitioners. There's a clinical laboratory technician and a clinical laboratory scientist. Clinical laboratory technician is someone who graduates from a community college with an associate degree. A clinical laboratory scientist has a baccalaureate degree. Now, the difference between the two is actually 2 years of study, but also in clinical laboratory science, you get more in depth into medicine and the diseases that are associated with the different laboratory tests. Um, so you can actually do more in the lab than a clinical laboratory technician could. But clinical laboratory technician can be a stepping stone. I started that way. So it'll give you a chance to see if it's really for you or not. And you can also work while you're going to school for your 4 year degree. Now, when you graduate from a college like St. John's with your bachelor's degree and a major in clinical laboratory science, our students are eligible to take a national certification exam. This exam is really important for two reasons. The first reason is when you pass that exam, this certification is recognized all over the country. So if you should leave New York and go to another state, you'll be able to get a position. The second reason, here in New York, we have a license to practice clinical laboratory technology. And passing that certification exam and getting your degree from St. John's in clinical lab science will get you your license to practice in the state of New York.
Excellent. Thank you so much, Lisa. If you were to give a young adult or a high school student some direction and tell them where to go to get additional information on your specific career choice, where would you point them?
Well, most high school students today, they know to Google what they don't know or what they want to find out about. And if you were to Google clinical laboratory science, it will send you to some good sites, ones that explore clinical laboratory science as a career, and also some professional organizations that can help you as well.
Thank you so much. What kind of changes did you see this year in your specific career? And where do you see those changes going in the next couple of years?
Well, this year has been, I guess, somewhat of a revelation for those of us who work in a clinical lab. Clinical laboratory science is not that well known as a major. Most students kind of stumble into it, but we've gotten a lot of publicity this year. We've all heard about testing for COVID 19, PCR tests, rapid tests, antibody tests. We've all seen on TV those drive in, what they call testing centers, where samples were collected to see if someone had COVID 19 or not. All of those so-called testing centers just collected the samples. The samples then went to a clinical lab where clinical laboratory scientists performed the testing to make the diagnosis as to whether someone had COVID 19 or not. So it was a lot of notoriety for people who worked in the clinical lab. I think most people had no idea who actually performed their laboratory tests, but it wasn't without its challenges. In the beginning, there were shortages of test kits, shortages of reagents that were part of the kit. But the biggest problem is the shortage of people, the actual clinical laboratory technologists to perform the testing. There's a tremendous shortage of people to work in a clinical lab, and it's a shortage that no one really knows anything about.
Can you tell us a little bit about the salary that lab technicians start at, and so the students can have an idea of where this is going in their with their careers and their earnings?
Okay, the first thing I need to kind of correct what you said. We are referred to as clinical laboratory technicians, which is wrong. A technician, as I mentioned earlier, is someone who has a 2 year degree. So those of us who are clinical laboratory technologists and have a 4 year degree, we take that kind of in the wrong way. As a four-year graduate, your starting salary is anywhere between $60,000 and $65,000 right out of school with very little experience.
And do you find that most of the colleges offer the types of courses that students would need to go into the lab technology divisions?
Well, what you need is a major in clinical laboratory science. You cannot be a biology major and work in a clinical laboratory. They do not have the educational courses that are required, nor the clinical training to obtain a license in this state.
Excellent. Thank you so much, Lisa. So we want to thank James and Lisa for sharing their information about their careers and their education requirements. And again, I want to remind everyone that I am Toni Arcamone, Manager of Volunteer Services at Staten Island University Hospital. And as James initially said, if you are looking to enter the healthcare industry, probably the best way to see the inside workings of healthcare is to volunteer, whether it's in the hospital, in a doctor's office, in a physical therapy environment, to see if this is the life that you really want to be part of. Being in the healthcare industry is rewarding in many ways. And I think, as both Lisa and James pointed out, there's so many different avenues and educational requirements for the different disciplines. We thank you so much for taking part in today's CareerCon, and we hope to see you soon.